Friends, first of all, I want to say that even if your osteoarthritis is already progressing, that's no reason to avoid physical exercise. On the contrary, scientific studies show the opposite, that moderate physical activity is an excellent way to prevent osteoarthritis. Even if you already have osteoarthritis, physical activity can slow down this process. Why does this happen? The thing is, the cartilage in the joint doesn't have its own blood vessels, and nourishment happens through mechanical diffusion. That is, when the joint is moving, nutrients are delivered into the cartilage through the synovial fluid. That's why, to improve nourishment, we need the joint to be constantly working. I want to draw your attention to the fact that any physical activity can be beneficial, but it can also be harmful. If you have joint problems, you should stick to moderate physical activity. Intense physical activity. Activities where you feel pain in the joint. These are absolute contraindications, because we shouldn't irritate the joint even more. If you feel the pain getting worse while doing physical exercises, stop doing those exercises. You're only making things worse. You need to work up to the pain threshold. And then, on the contrary, you'll get a positive effect. There are several types of cardio exercises that have a positive effect on the joint. First is Nordic walking, second is swimming, and third is the exercise bike. That's why I recommend including these in your daily routine. There are certain muscles that, as we age, become more hypertonic and contracted, and they disrupt biomechanics, which increases friction in the joints. And this leads to premature osteoarthritis. Now I'll tell and show you which muscles need to be relaxed and which ones need to be toned. So make sure you're subscribed to the channel so you don't miss these videos. Let's get started. So the first exercise. It consists of relaxing the iliopsoas muscle. Because when the iliopsoas muscle shortens, the pelvis tilts forward. As a result, mobility in the hip joint decreases. At the same time, the thighs also rotate inward. This creates improper stress on the hip joint. What we need to do is open up the pelvis and hip joint and restore mobility. So, we are going to relax the iliopsoas muscle. I recommend this to everyone who has problems with their hip joint. For this, you'll need a pillow. I've already prepared one so you can place it under your knee to avoid injuring it. You put the pillow on the floor, then place your knee on it and take a lunge like this. With your leg, what do we need to do in this position? Look, your pelvis. You rotate it backward so that your tailbone drops down as much as possible. And in this position, while you're holding your pelvis, you start to shift your hips forward. What happens then? You should feel a sensation as if something in your groin area starts to stretch. You can also tilt your head back a little. Look up, and you'll feel a strong stretch. This is exactly what we need. This muscle, as we age, it shortens and causes a lot of problems, and it negatively affects the hip joints. So in this position, we simply take and stretch this muscle. That is, keeping the pelvis as far back as possible, so that the tailbone and sacrum drop down. What else can you do here? Reach the point of maximum stretch. Look up. Then press your knee down and forward. For 5 seconds as you inhale. Take a breath in and press. After 5 seconds, you'll feel a burning sensation. The muscle starts to burn. Perfect, it's working. Then exhale and relax. Release the tension and stretch this muscle 3 times. I recommend doing the same thing on each side. Then switch to the opposite leg. By the way, you might actually feel that your pelvis is literally loosening up, becoming lighter. If you compare the sensation on the left and right, then do the same thing on the opposite leg. Place your knee on a cushion so you don't end up with knee joint osteoarthritis. Again, do the same thing. Look, the pelvis. We need to tilt it back. When you tilt your pelvis back, you feel a stretch. Right here. And once you feel that stretch, start shifting even more forward while keeping your pelvis in position. Do it moderately. Again, don't push through strong pain, because you'll get the opposite effect. And in this position, you can simply stretch. Yes, or you can look up. The stretch will intensify and press down into the floor and forward. Do this as you inhale for 5 to 7 seconds. Inhale and press. You'll feel a burning sensation. Then exhale and release. And stretch again. Often, when a joint clicks or cracks, it's actually due to shortening and tension in the iliopsoas tendon. When you relax, the cracking in the joint goes away, and your mobility increases. And after this technique, you might notice that your pelvis starts to move better. Accordingly, your hip joints are also freed up. The next myofascial structure that negatively affects the hip and knee joints is the iliotibial tract. This is a myofascial structure located along the outer side of the thigh. It runs down from the iliac bone and goes below the knee. And often, due to improper biomechanics, when our pelvis is misaligned, when the iliopsoas muscles are tense, the internal rotation of the hip is affected and these iliotibial structures become overstrained. This leads to stiffness in the hip joint area, and it can cause pain along the outer side of the hip joints. Secondly, it can create improper biomechanics in the knee joint and accelerate knee osteoarthritis because it literally twists the knee joint and disrupts normal biomechanics. That's why it's essential to relax these structures. It's very simple. You can do this against a wall. Just lean on the wall and cross one leg over the other. So, if you want to work on your right iliotibial tract, you need to put your hand on the wall and your right leg. Cross it over your left leg to create maximum tension. And next, we're going to lean sideways to the left. As a result, this myofascial structure will be stretched. Let's do it together. So, I stand sideways to the wall and stretch out my arm. And next, here's what I need to do. I cross my right leg over my left leg. So I bring my right leg over my left, and then my left arm. I lean onto my left side and start stretching like this. And here, the main focus is to make sure you're stretching everything below the pelvis. Everything in the hip joint area and below starts to stretch. You might feel a burning sensation, and we begin to stretch it out. You can go to the point of maximum tension and stay in that position for a while. Stay in this position for 10 to 15 seconds. Take a deep breath in, exhale, and relax. And then repeat. This is a great exercise that stretches the iliotibial tract. And we do the same thing on the other side. So, stretch your arm out. Now bring it over. Now, put your left leg over your right leg. Now I start stretching the left side, literally leaning over so that you feel the stretch. It's very important to lean just enough so that you feel the stretch in the hip joint area. Once you feel the stretch, keep stretching. Great job. If you do this every day, even now, those of you doing it with me can probably feel that. It becomes much freer, easier, and more relaxed. The iliotibial tract. There is an international scientific study that has proven this reduces pain in knee osteoarthritis, as well as in the hip joint. Friends, I just showed you 2 muscle relaxation exercises, and they are very important. First, you relax these muscles, and after that, we will strengthen the muscles. Strengthening the gluteal muscles, especially the middle gluteal muscle. And the quadriceps muscles reduce pain and improve the condition in osteoarthritis of the knee and hip joints. What can be done? The first thing I recommend is to do the following. Shallow squats. The thing is, if you do deep squats, there is friction in the knee and hip joints. And accordingly, if there is already cartilage damage, this will cause pain. That's why I don't recommend doing deep squats if you've already been diagnosed with joint osteoarthritis. But squats can actually be beneficial if you do shallow squats. And it's been scientifically proven that patients who do squats as part of physical therapy, going down to about 40 degrees. In the knee joints, they strengthen both the knee and hip joints by strengthening the quadriceps muscle. Because when you squat, your quadriceps muscle contracts, and your gluteal muscle also gets involved a bit. So what do? You place your feet right in line with your shoulders, and then you start doing shallow squats. That is, you don't go deeper, so you don't provoke pain. We start doing them smoothly and slowly, meaning you can do as many as feels comfortable, maybe 30 times, or even more if you want. You can do 20 reps, then rest for a minute or 2, and then do another 20 or 30 reps. And then you can repeat this for 3 cycles. These kinds of shallow squats, they are safe for people with joint osteoarthritis. To keep the knee joint healthy, you need to strengthen the quadriceps muscles because the quadriceps hold the kneecap in place and stabilize the knee joint, balancing the proper load inside the knee. What else can you do? There is another exercise to strengthen the quadriceps. It's especially important to do this if you have problems specifically with your knee joint. For this, you'll just need a chair. I'll show you. You sit down on this chair. Just sit down and you can relax, watch TV, and at the same time do exercises for your knee joints. What are we going to do? You need to straighten your leg one at a time. So, you just take your leg and straighten it. What happens then? This exercise works the quadriceps muscle. And you may feel that it specifically works the kneecap and all the muscle structures around the knee joint. They get toned. They strengthen the knee joint. This is very important for proper biomechanics of the knee joint because osteoarthritis progresses due to improper biomechanics. When the muscles don't work properly, when some muscles become very weak and others become very tense and shortened, this starts to disrupt biomechanics. There are 2 joint surfaces. If the joint surfaces are aligned evenly with each other, then the load inside the joint is distributed evenly. If one muscle is tense and another, on the contrary, is weak, then the axis of the joint changes. And often this leads to either the inner or outer surface wearing down. More often, it's actually the inner surface. This kind of imbalance occurs. That's why, to restore balance, we need to bring the muscles back to the right tone. So, you do this exercise on one leg 30 times, several sets, and then switch to the other leg. It's a very simple exercise, and most importantly, these exercises really do help with knee joint problems. Friends, these techniques really work, but you need to understand that the body is a holistic structure with hundreds of thousands of different elements. I have a course where I teach you how to work with the whole body. The body is a unified system that includes internal organs, blood vessels, and nerves. If you know how to work holistically with your entire body, it increases your results tenfold. I've left a link in the description of this video. Be sure to check it out. And the next muscle you need to strengthen is the gluteus medius and maximus. These muscles determine the position of the pelvis and how the hip and knee joints function. I believe that the simplest and most effective exercise you can do at home is the glute bridge. The glute bridge itself strengthens the gluteus maximus. But if we do a single leg glute bridge, meaning with one leg, then the stabilizer muscles are also engaged. The gluteus medius also gets activated, which is very important for the hip joint. And strengthening it actually reduces pain in the hip joint. How do you do a single leg glute bridge? You lie down on the floor. And then, look, a regular glute bridge is when you lift your hips off the floor and your glute muscles are engaged. If we do this with one leg straight or bent, meaning we lift up on one leg, then the stabilizer muscles also get involved, especially the gluteus medius. How high can you lift yourself? If it's hard to lift up, just try your best to raise yourself. This way, you strengthen both the gluteus maximus and medius. Do as many repetitions as you feel comfortable with. You can even do just 6 reps. The main thing is to make sure these muscles are activated. And in this position, it's even better to hold for 1 second. Do this at least 6 to 8 times for 3 sets. After that, switch legs. Lift this leg off the ground. So you're standing on one leg and start lifting up and your muscles get engaged. You can also do it with a straight leg. Or like this. So these exercises, specifically the single leg glute bridge, you do 4, 6, or 8 reps, 3 sets on each side. And this strengthens the gluteus medius and maximus muscles. This alone may be enough to stabilize your hip joint, reduce pain, help your joints function better, and stop the progression of osteoarthritis. Friends, if you did these exercises with me, please write in the comments how you feel after doing these wonderful exercises. I want to emphasize once again that these exercises are used in many therapeutic physical training programs. They are designed to prevent osteoarthritis. It has been scientifically proven that these particular exercises improve the function of the hip and knee joints. And your joints will simply become healthier and healthier, and it's even possible that osteoarthritis could disappear completely. This primarily applies to stage 1 and 2 osteoarthritis, of course, at stage 3, and especially stage 4. These exercises will already have limited benefit. Please, don't let your osteoarthritis progress to stage 4. Start doing these exercises even if you don't have osteoarthritis yet. And even more so, if you already have stage 1 or 2, these exercises will help you a lot. Friends, if you found this video helpful, be sure to subscribe to my channel, because I post videos like this every week. This was Dr. Alice with you. See you next time.